Friday, September 30 will be the last day for outpatient hemodialysis services at the Guam Memorial Hospital. According to GMH Chief Financial Officer Siva Karupan, it is part of the numerous cost-saving measures the hospital is taking as part of GovGuam's financial situation.
We found that the outpatient dialysis service can be better served outside the hospital by private dialysis facilities. This is also a tremendous cost-saving measure by the hospital. We estimated that we would save close to $800 to $1 million in closing our outpatient dialysis services.
Karupan says the ending of services affects nearly 40 patients, but GMH will still offer inpatient dialysis services. Those patients will be referred to one of 4 private facilities owned by the Guam Renal Center, which are Guam Renal Care in Hagåtña, Guam Dialysis Center in Tamuning, Renal Centers of Guam and Harmon, and Tumon Kidney Center in Upper Tumon. He adds the outpatient hemodialysis center at the hospital frees up space while GMH remodels the intensive care unit, which permeates noise.
One thought is to move those patients on a temporary basis away from the noise and construction activity into, on the first floor where the outpatient dialysis facility is or used to be. And that way it will separate the patients from, hardship, turmoil, and so on and so forth from all the noise pollution.
The ICU renovation is being paid by ARA funding. Although it won't stop any other services in the hospital, Karupan is looking at every department to find ways to cut costs.
We are certainly taking a look at the emergency room department and trying to see if it is financially and fiscally feasible to privatize that department. We are also taking a look at the radiology department to see if that is also financially viable for the hospital to privatize.
GMH has found a new vendor for transcription services, cutting its $26,000 a month payment nearly in half. It also engaged with a local company to provide Voice over Internet Protocol, or VoIP, services that will dramatically cut over 300 phone lines but produce a savings of nearly $20,000 a month. He hopes the cuts will ultimately enhance how the delivery of care is rendered to patients. Additionally, the hospital is working on more improvement in services following the Joint Commission's visit in late August and concerns raised by the Centers for Medicaid. Karupan does say to entertain the Joint Commission, the hospital had to fork over $30,000 for the unannounced visit, money of which the hospital doesn't necessarily have lying around.
I think personally, from as a Chief Financial Officer, that we are spending a tremendous amount of money in making sure that we are JCO accredited. I'm not really sure what the cost-benefit analysis is for that.
Karupan says GMH should really be focusing on the Centers for Medicaid, which had granted the hospital more time to comply with federal life safety code requirements. Reporting for Guam's News Network, I'm Ken Quintaniza.